if I didn't like the way my socks felt or my shirt felt, nobody understood that as, just needing a different way to kind of wear those items or figure that out. It was almost like, oh, you're being difficult. Just put your socks on. So
Yeah.
yeah, I think just, for parents to reframe and for everyone to kind of just have a different lens is pretty valuable nowadays. And it just hopefully is kind of headed towards where kids feel way more supported and can grow up with these strategies because they will be the adults of our future, right?
Hello and welcome. We're so glad you're tuning into the Taking Good Care show. I'm Dr. Andrew Wong, based in Toronto, Canada.
And I'm Dr. David St. Arnaud, based in Edmonton, Canada. We're two practicing psychologists with over a decade of experience each, working in a variety of settings and supporting diverse populations.
Thanks for joining us. We hope you enjoyed today's episode. While we're both practicing psychologists, our podcast is intended purely for educational and entertainment purposes. It's not a substitute for professional mental health care or treatment. If you're in need of support, we strongly encourage you to reach out to a licensed mental health professional in your area.
Good morning, everyone.
Good morning, Dave.
Good morning.
Morning.
All right.
We've got a couple other voices with us today.
We do. We are excited. We have our first OTs on the show. So welcome to Venita, Rajput and Kassandra, Rago. They are pediatric occupational therapists, or OTs for short, with over a decade of experience supporting children and their families. They first met in 2015 working at a school-based setting, and they quickly discovered that they had a passion for creating therapeutic group programs. And in 2019, they launched their first group program called Mighty Munchers, which was a feeding program designed to support children who are very particular about foods they eat. Anyone with kids out there, that I'm sure you can relate, but it is on a spectrum. So, and in terms of their work now, they have grown. They have their own practice providing groups for children. Today, they offer a variety of focus on emotion regulation, social thinking, play skills, executive function, along with group therapy. They also offer individual occupational therapy sessions and professional development. They enjoy collaborating with community partners and always open to new ideas and approaches. They are passionate about working with children and their families and help them grow confidence and independence in everyday activities. So, I'll just add a little bit, because the reason they're even on this show is because I attended one of their groups with my son way back, I think probably 3-4 years ago. And they've always been in my mind about like some great practitioners out there in the community doing great work. And so I'll speak a little bit more to that if that comes up, but this is the reason I reached out to them, and I'm glad they agreed to come on the show and talk about the work that they do and have been doing for quite some time now, and even just kind of helping the general public understand the scope of practice and what OTs do and can do. So welcome.
And I should add too, Kassandra and Venita are located in Edmonton, Alberta, and you can find them at mightyots.ca, as well as on Instagram at mightyots. So that's mighty and then OTS. So yes, welcome. And it's nice to meet both of you, because I've never met you before, except for a little brief introduction earlier. Dave knows the two of you through the programs, but yeah, welcome.
Thank you. We're excited to be here.
Amazing. So I guess to start off, occupational therapy. I know when I first heard of occupational therapy, this is probably also through the school board. When I first went through my practicum during my master's, this was way back in, I want to say 2008, somewhere there. I heard about occupational therapy. And to be very honest and candid, I had no clue what occupational therapy was. All I knew was, if I just take the word occupation, it's like work. That's what first comes to mind, right? So it's like, what do you guys do? And so I think just throwing it out there, if we're starting from scratch, I'm wondering if you can tell us more about occupational therapy and what it means and what you do.
Yeah. So honestly, I didn't really know what occupational therapy was until I went to school for it. So it's completely understandable. I know when people ask me what I do and I tell them I'm an occupational therapist, a lot of them don't really understand what that is. We have a pretty broad scope. You can find us everywhere. Hospitals, schools, WCB, so many different places. Kassandra and I were more pediatric OTs, so we specialize in working with kids. And as pediatric OTs, what I like to say is we essentially help kids do the everyday things they need or want to do. So things like getting dressed, play. Play is really big. Learning to play with others, managing their emotions and regulation, writing, and other self-help skills such as toileting. If they're picky eaters, we can support with that. So there's quite a scope of things that we can work on. And so essentially we try to support them in things that might be challenging for them so that they can manage every day. I don't know if you want to add to that.
Yeah, I kind of just always say that basically we are just about helping people get back to doing the things that they love. When we practice a lot, we're very goal oriented, but a lot of the goals have to come from what motivates people and what people want to get back to doing. And so for kids, as Venita mentioned, a lot of it is about play and social interactions and having success in kind of everyday activities like going to school that might be really hard, or going to family functions that might be really difficult, or community outings. So our scope is quite broad, but we always kind of hone in and tailor to what the family's motivated by, what they really want to see, become successful for their child and just for their family unit as a whole.
Yeah, that's been my understanding too. I have a brother-in-law who's an OT, and I kind of, in the background kind of learn about it. And even when you guys were talking, it's like we had the episode with the speech and language pathologist, right? And she talked about feeding, and I'm like, oh, there's some overlap between what OTs can do and what speech paths can do, and there's overlap with what psychologists can do and what OTs can do, and there's overlap with, so there's a lot of overlap, and that's been really kind of neat to understand, and that you might be able to help people with more than one thing that like other specializations aren't able to. So
yeah, there's a ton of overlap for sure. We kind of insert ourselves wherever but that's very special, I think, to our occupation, because we work with a lot of different professionals very closely. In the schools, it's a team approach for sure, and I always just find that very special about my job, because yes, there's overlap between myself and a psychologist or a physiotherapist, but we come at it from different lenses, and we kind of both contribute our own specialties, and that's kind of, you see the magic happen when you work very closely with colleagues. So it's fun. Yeah.
So I think that's where I don't know if any further distinction can be made, because there is that overlap. When would a family or an individual come to an OT for help? Because, for example, I'll just throw it out there, like executive functioning, right? That's something that, let's say, psychology can also tap into, but also OTs can tap into that too. And so is there a distinction, or is there such overlap that there really isn't a distinction? And then on top of that, when should families think about going to an OT in terms of presenting issues?
Yeah, I think we both kind of contribute some of the same maybe types of strategies.
Right.
Psychology and OT might kind of be the same types of strategies. Sometimes what I find is if I'm working on executive functioning, I'm really working on the functionality. So I'm often with the child at school, helping them organize their desk, helping them come up with a system for organization, or, helping them come up with an actual strategy that we can give back to the teacher to promote writing or something like that. And then it complements well what they might be doing with a psychologist at the same time, which might be looking at a whole family approach to support the child. Or it might be more in-session work kind of at the clinic. So yeah, for me, I think there's so much overlap. I think sometimes too, it's just about where the availability of resources are. So, sometimes it is more feasible for families to go to psychology for certain things, especially if there's some comorbidity with some mental health. And then sometimes if it's like a school-based or a private-based, OT might be a little bit more affordable or more kind of just the right resource at that moment. Venita, I don't know if you would add anything else.
Yeah, I think the only other thing I would probably add in is it also depends on the training and experience that an occupational therapist has as well. So not everyone has training in executive functioning, or not everyone has training in, working with children with feeding sensitivities. Kassandra and I, it was definitely something we were both passionate about. So we both took specialized training in it so that we could support families. as well. So yeah, I think a lot of it is also the experience. I do feel like our scope has grown so much since I first started as an occupational therapist. I think when I first started working at school, my job was mainly to help kids with their fine motor skills. So how they use their hands to hold a pencil, cutting, coloring, drawing, which are all very important skills. But I have found like over the years, what I consult on and how I work with kids is so different. I have some children that I'm working on executive functioning. I'm working with fine motor skills. I'm working with feeding, self-help skills. So I feel like there's just, yeah, so many different areas. So it really depends where you have experience as well.
Yeah, I think that's kind of my understanding is like the training and the title of an OT is quite broad. And then depending on how you specialize or the extra training that you do probably after you get your degree is the work that you end up doing more of. And it makes me think, and correct me if I'm wrong, like when I think of OTs, I think of like more hands-on, like you said, helping kids like how they're holding a pencil, or when like WCB work, like workers' compensation work, when people are returning to work, like a lot of times I hear about OTs going with them to their workplace, where psychologists rarely do that. Like we have people come to us most of the time, and OTs are like more comfortable or more trained in actually going to where people are at, whether it's their home or their work. Okay,
Yeah.
I'm seeing some head nods.
Yeah, totally. Like, I mean, there are OTs that have their own clinic, but I would say that there is a lot of value. And Venita, you might be able to speak more of this. She's dived way more into the private world than I have lately. But yeah, there's some value in going into somebody's home and space. And if you think of something like feeding, the struggles are happening at home. So kids can develop some skills in clinic, but with the types of kids we work with, that's not always generalized or transferable to other environments. So it helps to have that therapy happen in the environment and kind of looking at the factors of that environment that might be contributing to some challenges and making the appropriate changes.
And then Mighty OT, so you are doing more pediatric work, and I'm wondering what are some of the, I guess when it comes to the most prominent or in terms of like the most frequent referrals that you see, what are some of the things that often families will come to you for?
I would say lately, a lot of it has been about regulation, emotional regulation. That part of the reason that Kassandra and I started doing more groups, our first one was the feeding group, and then the next one that we started was a regulation group because we just saw a huge demand for it. And so I feel like that's been a pretty big one.
I totally agree. Yeah, you're seeing all types of kiddos come to regulation, and it's also just expanding knowledge to families, to parents, what regulation all entails. And it's also just like, what does dysregulation look like? Sometimes is a big part of it. So it's not always the kids that have huge aggressive outbursts. Sometimes it's those kids that withdraw and shut down and then also need strategies for that. So yeah, I would say like regulation has been the biggest factor. And a lot of things fall into regulation, like executive functioning and social thinking and all the other groups we've developed. So we needed something that could keep families going and tie everything together.
I know Dave wants to ask something, but
Yeah.
I really want to go.
Okay, you go first. You go first.
Why groups? So that's one of the things that you mentioned. Like groups was something that came early, it seems like, at your practice. So in terms of groups versus individual work, when it comes to, let's say, self-regulation, what was it about groups that you found perhaps to be more beneficial or more effective versus individual work?
Okay, so I think there's two reasons. I think the first reason, Venita and I we met in school-based setting, and we met in a pre-K setting. So in preschool years, that's really when you're helping families to kind of explore the world of a potential diagnosis that's kind of having some challenges. And you're really then going with, okay, if there is a diagnosis, what kind of community supports are out there for you at home besides the school, which can be quite limited. So what we really found was that there wasn't a lot of affordable options for families. There wasn't a lot of kind of settings where, yes, you're working on regulation or social skills, but you can really only do that sometimes with other kids. Sometimes, depending on the goal, you really do need some companionship to work on some of these things and to practice some of the strategies. And so we thought, hey, like, let's start some groups, because I think what these families really do need is just a more affordable option versus private therapy rates. And we also need some other kids there so that they can actually practice some of these skills that we want them to excel at.
And then I think the other reason would be that what we found with groups. So Cassandra and I, when we started in 2015, we did do some groups in pre-K. And what parents thought was really nice was that they got to meet other parents at the same concern. So we kind of created that like community. And I think because sometimes parents were feeling like, oh, it's only my child, or felt a little bit isolated. They were the only ones dealing with it. And so the feedback we got was like, it's so nice to meet other parents and be able to talk about concerns and have people that can relate to it. And then it's also really nice for the kids. I know sometimes in our groups, what parents have said is, it's been so nice for my daughter to see that she's not the only one that has these challenges. It's been really helpful for her to be able to, for others to be able to relate to her. So that was something that we thought was really powerful about groups, just some of those connections that parents and children did make.
The power of groups.
Yes.
Yeah, yeah. I could probably go on about this forever, but even as a participant in the group, as you were talking, I was remembering seeing some of the like one parent and one child that was in the group, and I didn't know them before the group, but then I'd see them in the community, and there was this like connection. We could look at each other and be like, how you doing? Like, how's your kid doing? And how are like, and even just knowing the struggles of the children and then seeing the progress. Like, so if you like, I met at a soccer field, right? And I'm like watching my kid and her kid, that right. And it was like, oh, cool. We got to know each other in a certain setting and kind of in a vulnerable way, right? Like other people might not know the struggles that we're going through, but we had this connection, even though we, never knew each other. So that was really a side benefit to know that, you're not alone, that your kid's not alone. And your child also had that same, at least my son had that same kind of experience, that it's like, hey, we're all going to this class or this group, that it's not just me getting pulled out of class for special help, right? It's like other kids too are working on this. I was thinking, as much as like people might not understand what an OT is or what an OT does, they also might not understand self-regulation. And we haven't really focused on that in our podcast. So it might be nice to just give a quick definition, because I think this is a new term that wasn't around when our parents went to school. So
Yeah, so regulation, it's one word that has a pretty big meaning. That's what we always tell parents, but it's essentially the ability to control and manage things like your emotions, your activity levels, your behavior, so many things, so that essentially you can function in different environments and build different relationships with others. That's how we like to define it. So one word with a pretty big meaning.
well, and maybe the contrast, like what is dysregulation, or what does that look like for people to kind of have an idea of what we're talking about?
Yeah, I think for dysregulation, it's, just when you have difficulty shifting your activity level to match the task. So there's always a quote, which is that we like from NeuroWild, that's kind of like, regulation is basically being able to match the task. And that's not direct quote because now I can't remember it. But when you have difficulty matching your context, matching your task, then we say that you're dysregulated. So to put that in a setting, as if you are trying to go to sleep, you need to calm your body, you need to kind of enter a state of calmness and of peacefulness in your body, slowing your breath, slowing all down in your body physically and mentally. And when kids can't do that and they're very hyper and they're running around and they can't settle, then you could say that looks a little bit dysregulating in that moment to them. So they're not in the state to function at bedtime, you could say. So then strategies work on calming.
And I'll jump in here a little bit just from a brain-based perspective. This idea of regulation for children, for the age groups that we're, let's say, talking about from elementary school, that prefrontal cortex area, so that front part of the brain is very underdeveloped. And this is why throughout the teenage years, you see a lot of development there, but also a lot of mistakes being made, whether it's silly behaviors or not thinking about certain consequences. And so when we talk about this ability to regulate, it's, being able to self-soothe or have the capacity to do that, or even to organize our time and understand priorities. And a lot of parents get a kick out of this stat or this fact, that with executive functioning or regulation, For boys, it's for the male brain, it's not usually developed until our early 20s. Some research will show that not until 25, and parents are like, oh my gosh, my son is doomed. And then for girls, it's around 20-ish where we'll see that to be fully developed. But having said that, I do wonder, with respect to what both of you were saying about regulation and dysregulation, there seems to be a lot of parent involvement as well, right? So in terms of my practice, initially we'll get parents who are like, you know, can you fix my child? Right. And, first of all, I'll correct them in terms of this idea of fixing, but I also try to bring in the team, so to speak, right? It's not just me meeting with the child to say, okay, this is what you have to do, and suddenly they're quote unquote fixed. But it's a lot of parent work. And I wonder, in terms of the OT world, are you doing that as well?
Yeah, absolutely. So with our groups, that's part of it. I think what sometimes makes our groups unique is that parents have to come with their children and they stay for the group, and then we educate them on a concept. And so the first one we always start off with is, what is regulation? And then we also talk about self-regulation and co-regulation. So self-regulation is when we use tools and strategies on our own to help us regulate. And co-regulation is when we get support from others to help us regulate. So younger kids, preschool or babies, preschoolers, they often rely on co-regulation. So sometimes when parents will say like, oh, like he can't calm down and he just melts down right after school. What can I do? And so we talk a lot about co-regulation, how we need to be there and we need to support them. They're not going to know to take their deep breaths on their own, or to get some sort of tool like a fidget tool, or maybe they need that tight hug. We have to help them co-regulate by being there with them.
Yeah, that's like you said, the biggest, I think one of the biggest benefits of our group is the parent education portion, because even if you don't carve out time for that, it's really hard sometimes to properly educate parents or teachers. Sometimes a lot of my work in schools is done in the moment and teachers are busy and it's really hard. So it's really important to meet after, because it's the adult that has to really help children implement these strategies. And when we talk about dysregulation in terms of like sometimes aggression or what things might look like in peer situations or in the classroom, it's really the adult that has to help the child find the tools, especially at very young ages. It's probably not till about age 9, 10 that children can start to be a little bit more independent, kind of vocalize, oh, you know what, that deep breaths don't work for me. It's really the adult that has to notice these things about the child and just help them develop something called how do you say it now, Venita?
Interoception.
Edit that out. Interoception, which is, a topic we could talk about all day, but interoception is really that sense of, how does your own body feel when it's regulated or dysregulated, which is different for everybody because we all are unique in our own bodies. And so a big part of teaching parents is, how do we help kids recognize these things about themselves? How do we, stay regulated ourselves through hard moments so that we can present some calmness and help our child through that hard moment? So yeah, I think definitely coaching and consulting, those are big words in our world, because that is a huge part of our job.
And then the other thing I wanted to mention with co-regulation, we rely on co-regulation all our life. It's not just with kids, but as adults too. So this is what we always tell in our group, that as we get older, we are able to regulate more on our own, recognize the tools we need. But as adults, we do also rely on co-regulation. So if you had a really bad day at work and you're really stressed out, you might go vent to a friend or something like that. And so that would be an example of co-regulation.
I think that this is kind of important to distinguish and to also look at like the overlap and how this all works, because again, these are new terms for a lot of people. Like this idea of co-regulation, I think even as psychologists in our office, that's a big part of what we do. Someone comes in distress about something, and if we're regulated, they can co-regulate and go like, oh, maybe I'll be okay. But if we freak out and we're dysregulated, then they get more dysregulated, and that spiral. And I think we're kind of hardwired as a human species that if someone is anxious or worried about something, we better pay attention to that, right? But I don't think we've really highlighted or like understood how this works more than we've focused on more recently in the last like 10 years, just even in a school setting, with how regulated the teacher might be at the front of the class, and then how regulated the students might be, or where the student sits and who the student sits by, because they could borrow kind of like that regulation from someone next to them and it'll help calm them. And they can have those individual strategies that we've tended to have more focus on, I think, in our work.
Or even, I was going to say, even like why two students who can egg each other on and completely get each other dysregulated.
It's funny what David was saying. It totally brought back an example for us. Another part of what we do at Mighty OTs is we get asked to provide PD to other organizations. So whether that be early childcare settings, daycare, schools, that kind of thing. So one of the things that one establishment was having some issue with is kind of the staff. Like, we have some really strong staff, but they don't understand that when they enter a comm room with a loud voice, it just riles everybody up. So could you slightly somehow approach that with the staff and talk about that you have to be regulated, and that your regulation affects the kids' regulation and other people's regulation. So it's funny, that just reminded me of that with the teacher example, because it's true how that can really reflect the whole regulation of a group and impact that.
Yeah, we often, when we do our PDs or even in our groups, we talk about what tools we use to regulate. So, for example, I'm totally a gum chewer if I'm feeling a little bit more, like whenever I wrote tests in school and stuff like that, I was always chewing gum or chewing on my pen. And I never knew why, but I realized now, after being an OT, that's probably something that helped me to regulate. So we talk about how we need to use our tools and make sure that we are regulated in order to support the children we work with.
You saying gum chewing, yeah. I actually just realized that after doing the group that I attended with you guys, that was one of the tools. And I have like the big bubble gum, in the soccer bag, I have it in the school bag, and a lot of other people won't understand, and there is a rule that you're not supposed to be chewing gum in certain areas, and I get why that's there. But for my kids, for my boys, if they're chewing gum, that is so helpful for their self-regulation. And both boys will chew gum while they're playing soccer because it's already quite overstimulating for them. Yeah. And so I got that tool from you guys. So thanks.
Oh, awesome. Yeah, it's amazing how powerful gum is. Yeah, we've had a lot of families who are like, what? How did this work? Just a piece of gum can really help them settle. And so we talk a lot about that. But yeah, that's what we're here for.
It's part of the sensory too, right? The sensory stimulation. I wonder with chewing gum, for example, you are moving your mouth, the jaw muscles, you're feeling that sort of tension and relaxation over and over again. But also I think even just, I wonder, and you can correct me if I'm wrong, just the salivation, right? You're getting a taste, you're getting something different in your mouth, all those little pieces of sensory stimulation. I wonder if that helps with regulation too.
Yeah, I think as OTs, that is something unique that sometimes we do bring to the table, is the sensory system. So it is something that we understand well. And basically, it's not just about any tool, and not all tools work for everybody. It's about finding the right tool for that child's unique body. So there are tool categories. There's categories that alert the sensory system. There's categories that calm it. And then there's our favorite ones that organize it, which kind of do both. So if you're feeling kind of low energy and you need to start being focused in a work meeting or a classroom, then you're going to need a tool that alerts and organizes the body, and vice versa. Some tools can, like gum is one of those tools. It can alert you, but it can also calm you if you are already at a heightened sense of alertness. So yeah, it's a big part of our job to educate parents about not just any tool, but the right tool. Sometimes in the classroom, I go in and, I give them lots of movement breaks is what the teacher is saying. And I said, I see that you do, but one of two things is happening. You're giving them a lot of fast-paced alerting movement and you're not following it with some calming movement. So now you've revved all these kids up to go back and learn, which might be really hard. Or the child that actually needs kind of the deep pressure and the proprioceptive input, you haven't provided them with the right movement. So it's kind of about, that's kind of where OTs really can, I would say, specialize in really doing that kind of informal or formal assessment on what strategies will help the sensory system. And when kids are really young, as you said, Andrew, their cognitive development is not quite where we would expect for self-regulation. So a lot of the strategies that we focus on are sensory-based strategies. You're using that kind of bottom-up approach.
It's not just sometimes one tool. We always say that you have to kind of have a toolbox of tools. So it might be sometimes gum, sometimes it might be a little fidget squishy tool. Sometimes it might be having a water bottle with a straw. So it's often, you need a toolbox of different tools as well to support regulation.
I remember when I was working at the school board, being on the autism spectrum disorder team. Our team had psychology, it had a resource teacher, consultant, SLP, OT, behavior specialist. And I remember one of the biggest, I think, values that OTs brought to the table was the sensory piece. Being able to go into schools and creating like a sensory room. Some schools had like an empty classroom and they created almost like a gym-based kind of environment. There was climbing, there was, in terms of tactile stimulation and somatosensory. It was like their expertise in that was just so valuable in understanding the sensory pieces with students. And I'm actually wondering, does your, I guess, clinic do a lot of work with students on the spectrum?
Yes, we do. There's this whole kind of new way of thinking of brains and the diversity within brains. So this neurodiversity movement, which has been really very positive, and this neuroaffirming practice. And so, yes, we get children on the spectrum. We get children who have ADHD. Sometimes there's no label attached, but there might be something different going on in their brain. And so it's been really cool because coming from a lens of just kind of saying that all brains are beautiful and everyone has strengths and everyone has challenges, I think kind of puts it into a nice perspective for parents, but also for children, in that there's no such thing as kind of kids that can sit crisscross applesauce and listen for half an hour straight anymore. And that if kids are a little bit fidgety or moving around and using tools, we normalize that nowadays. And that's really cool, because then everybody can kind of learn in the best way that works for them.
Yeah, and I also think with the neurodiversity lens, it kind of shifts the question from like, what's wrong with my child, to how can I support my child? How does my child's brain work so that I can help support them? So it changes the way that we're looking at children and working with them.
For sure. And that's a big shift, right? From, I think, any of the older generation that might be listening to this podcast. And if they are, even diagnosed or undiagnosed and really got kind of, I don't know, picked on or scolded or punished for needing to move around, and now we have like wiggly chairs in class so a kid can wiggle while they're listening, and it actually helps them pay attention. Or another tool that Kassandra, I thought you were going to mention when you were talking about like the down regulation or the deep stimulation, like the weighted blankets or the weighted
lap snake.
Yeah. Like I was going to call it a stuffy, but it's like a thing that a child could have with them, and it could be on their lap, and just that pressure helps them, right? And again, 10 years ago, 15 years ago, 20 years ago, these weren't even like tools. They were distractions, and they weren't allowed in classrooms or weren't allowed in certain settings. So I'm glad you guys are also like part of this movement that's helping a lot of children and adults reflect now on what they need.
Yeah, sometimes when we ask for feedback from our groups or we talk to parents individually, just last week, a parent shared like, I was the kid that needed these strategies and nobody taught them to me, not in school, not at home. It wasn't something that was recognized. It was very behavior focused. And it was like, I was the angry kid and I was the mean kid, but really I was a dysregulated kid and I just needed some help. And I agreed with him. I think even myself, speaking from experience growing up, like, if I didn't like the way my socks felt or my shirt felt, nobody understood that as, just needing a different way to kind of wear those items or figure that out. It was almost like, oh, you're being difficult. Just put your socks on, So I think just, for parents to reframe and for everyone to kind of just have a different lens is pretty valuable nowadays. And it just hopefully is kind of headed towards where kids feel way more supported and can grow up with these strategies, because they will be the adults of our future, right? So, yeah.
So, with respect to schools, have sort of come up a couple of times, and both of you have a background in working with schools, within schools, sorry. I'm just wondering, now that you are in private practice, what is the difference in terms of working as an OT within the school and what you can provide in the schools versus now that you're away from the school boards? And I'm just wondering if, like, just for any parents or educators who are listening, can you shine a light on the differences between what you can and cannot do, perhaps some barriers that you came across, but also successes that you had at the school board level?
Yeah, and actually Cassandra still works for the school board.
Ah,
So she
okay.
still works and I do more private
Correct.
practice. So yeah, when we're talking about sometimes we bounce ideas off of
Ah,
each
okay.
other. And it's always interesting to see because the strategies she can implement at school are different than what I would do in a home session. I think one of them would be we often talk about writing skills. Recently, I've been getting some referrals about writing skills for older kids. And so for me, I can do a full session working on printing and writing skills with a kiddo and go through letter formation and letter sizing. And I'm just sitting there for 1 hour working with that child on that. But I think in classrooms, that looks very different when Cassandra works with kids with writing difficulties and all that. Maybe Cassandra speak to that?
Sure. Yeah, it is. So, I mean, we don't have just the capacity of support to be able to pull kids aside in schools nowadays. So, and teachers can't, and the EA support is also limited to be able to do that. So, that really direct work is really non existent in schools. And so, it's nice when a student can have school based OT and home based OT, but often that's not the case. So, my strategies are often more universal and more kind of functional. So, a grade 4 student, my focus is not on correcting motor patterns of printing. It's not, I don't have the time to do that. And sometimes the students at that age just don't have the patience either. So it's now about your writing is quite illegible. What other strategies can we put into practice so that you can get some work done at school that your teacher can actually read? So sometimes it's still pen and paper, and I'm going with some very hands-on strategies. Sometimes it's looking at alternative pencils. Are we switching to typing? Are we switching to voice to text? What are the barriers to producing legible work or writing? And then so my strategies are quite different than at home for something like that, for sure. I will add too, Andrew, the barriers sometimes, so in our groups, sometimes we're teaching some really cool strategies and parents are saying, wow, I wish my child's teacher knew this. Can you talk to the teacher? Can you phone the school? Can we set up something? And we have to be very careful because districts have their own way and their own consultants and their own budget that many school boards don't allow outside resources to come in.
Right.
So that is one barrier. Sometimes it is parents transferring knowledge, which can be difficult, or advocating. I would say the most that we can offer is we can write you a letter of support to advocate that your school get OT services. And these are the things we found that worked in group, and maybe that OT can focus on something in school. So that is a big barrier that I wish which was not there, but it is. And I understand why it is, but yeah.
And so I guess with that being said, it's a bit of a different model here. I have found, even within different districts of school boards, they're pretty open to having outside help. It's almost like the idea that, okay, if you can help us and we've never heard your idea before, please come because we do need that help. Versus, it might be a little bit more restrictive in Alberta because people don't want to step on other people's toes.
Pretty much, and duplication
Yeah.
of services, and yeah, just I think it all comes down to budget and how, like, allocation of funds. And we have our own in-house team, but that team may not have capacity to see that child depending on severity. So it just depends. And every school board, at least in Edmonton and surrounding areas, works differently. That's the other thing that I find is depending on which school board you go to, the rules are always different about something like that. So it's really about finding out what the rules are first.
And sometimes it's been really nice. I know with me being in private, I sometimes have had the opportunity to collaborate with the school OT. They're not often able to see the kids as much as I have, but we really collaborate on different strategies that have worked. So if I'm working with on regulation with a child at home, so saying like these movement activities really work, or that weighted lap snake really helps, having a timer for transitions can be helpful, then that can be helpful for them to implement some of those strategies. Or having a calming corner. I will say, oh, with the family, we created a calming corner. These are the things that are in it, some lights, some fidget tools, maybe having that gum. And so then they kind of take some of those strategies and then they're able to go in and try to set some of that up in the environment that they have. So it has been really nice to be able to collaborate sometimes with the school OT. And it also gives me a better picture of this, of the child as well, too, because I find sometimes at home it's just the child and the parents, so it looks completely different. It's not as stimulating the environment as a classroom with 30 kids and all the noise and just the desks, everything in the room. So it looks very different. So it's really nice sometimes when we can collaborate with the school-based OT.
Well, and I think just even for parents to learn the tools and be able to apply the tools at home and find out what works and what doesn't work for their kid, and then be able to communicate that with even the teacher. And there might be things that can be done in the classroom without involving, that it might be readily available, but just not done or allowed in certain circumstances. So I know even for my kiddos, the teacher or the daycare staff, like they're sometimes asking me like, well, what tools, what strategies work at home so that we can try them here, because it'd be nice to know. And so this might be a way where parents can learn and then communicate that to the other people that, or even coaches or different people that are involved in the kid's life.
I have a question regarding sort of service delivery, because I think it might have been you, Kassandra, earlier. You had mentioned sort of comorbid or concurrent mental health issues that come with, different students, different children, teenagers. And I'm wondering, at your practice, how often are you seeing those types of presentations where you're seeing mental health also being an issue?
Yeah, the frequency of that has definitely grown. I think as I continue and Venita continues to grow as a professional, like we're always looking for new ways to expand our knowledge and learning. And that is something that we're really looking into, is how do we support a little bit more of the mental health? A lot of the kids that we get for regulation, parents will also disclose anxiety. And so yes, we work on regulation, but I think that because there is a mental health component, we need to work on the cognitive of some of those thoughts and kind of breaking some patterns. So as OTs, our scope, as we mentioned, is broad. So we are looking into how can we expand our own knowledge so that we can fit this into our regulation lens as well.
Well, and I think it fits quite well, because if you're looking at anxiety, if you're adding tools, right, like it would be, well, like self-talk, right? And what kind of thoughts do you have? And how might you calm yourself by talking to yourself a certain way, right? It's just another tool because anxiety, as much as it might be a worry or a concern or a mental thing, it's also a physical thing. Like our heart rate goes up and we get dysregulated because of the physiological aspect of it. So being able to, I know Andrew asked the question, but I'm like, oh, it's hard to kind of sort these things out to say what's a mental health concern or what's a regulation concern. Like there's a lot that we try to separate to make it easier for us to understand or work with, but I think there's a lot of overlap.
Yeah. And like I can just think of an example right now. I'm working with a junior high boy who's on the spectrum. And I'm quite concerned for his mental health. He's quite angry. He really doesn't find anything positive about his autism, and I think he's kind of headed down that depressive path. And so it's like we can work on a bunch of things like social thinking and helping him function better, whether it be at school or home or community settings. But I think we need to address the anger, the depression, the sadness that's going on to really make a difference. And right now, in my capacity, I feel a little bit limited. I need to call in a colleague that has more expertise in that area. So yeah, I want to expand my knowledge to be able to kind of provide that well-rounded and whole body therapy and intervention.
I think that really speaks to the importance of the interdisciplinary team, right? Whenever we can, whether it's bringing in SLPs in psychology or medical, just to bring everybody in at times to best benefit our services to the clients.
Anything else that you want the public to know that you just, like, maybe it's a soapbox thing that you tell all the parents and you just wish the world knew? I can ask a question like that. Or
for me, I just always kind of start our group sessions, the first session, kind of telling parents that my ultimate goal is to kind of empower you. I don't want you to leave feeling hopeless. I want you to feel empowered that you have something new to implement at home to try and help. And the other part of it too is doesn't matter what topic you're working on or what goal you're working on, things take time and it's often lifelong learning. And for me, I think, I'm a parent as well. And in a hard moment, I want a quick fix, of course. But, regulation changes throughout the lifespan. What works in the younger years is going to be different for older years. Same with feeding. They may be picky when they're young. They may not be picky when they're older or picky in a different way. And so all the strategies that we provide, whether it be social thinking, executive functioning, we're providing lifelong strategies that can be kind of changed and adapted. And that's what I want parents to really leave knowing that this takes time. It's not going to get fixed in 6 sessions, but we're hoping to give you a little bit more that you don't feel helpless anymore, that you feel like you have something that you can work with.
I think that's such an important piece of information for parents. The idea that time will continue to progress and, the challenges that they are seeing now may change as we move forward, or sometimes they'll look differently. Right. So one sensory issue that might be really bothering the family now may stop in 6 months or a year or 1.5 years. May something come back up 5 years from now? Maybe. Right. But I think it's this idea of adaptation, of seeking out help when we need it, and using certain strategies, adapting strategies along the way too, in order to really help their children thrive. And every child will thrive a little bit differently. Right. So there's not always this blueprint, because if there was a blueprint, I wouldn't have a job. But there's not always this certain blueprint that you can just follow. It's adapting along the way, and things will change, hopefully for the better.
Yeah, and we kind of always say like there's no magic wand. We wish there was one, but we don't have a magic wand. And we find quite a few parents do come back. They either repeat the same group or they come to different groups because now their child's a little bit older. And oh, you know what? When we did this at 4 years old, I don't know if they quite grasped it, but now they're 6 and I think they're going to get it. So we want to come back. And we love seeing families over and over again. Really fills our cup.
It's so funny because even this past couple of weeks, we've had a lot of returning clients, but these are all clients who maybe I saw them when they were still single digits, and now they're like 17 and getting ready for post-secondary. It's like, wow, time just flies. But they're coming for different reasons now, which is really validating in terms of just knowing that something worked before, and now they're hoping for something to work again.
Exactly. I actually just had a family contact me. So I worked with their son a few years ago, and we did the zones of regulation program with him, and it worked beautifully with him. The strategies really helped. And I just had the parent, she just contacted me, I guess 3 years later, and she was saying, you know what, he's a little bit older. The zone strategies, they feel a little bit babyish. Can you start working with him again and give him some more tools? And I was like, absolutely, that totally makes sense.
Yeah, I'm going to add to that because I feel like I'm kind of got one foot in the professional realm and one foot in like the parent, and I'm listening from, I think maybe both my ears. And so what I'm taking away, I love that Kassandra part around like, this, you're going to try things, and it's kind of a process. It's not like a quick fix. You're not just going to get one tool and then things change automatically. And so I'm even reflecting on my own experience and having my younger son return to the group. And I'm really kind of interested to see how this goes, because I know the first time we did it, whatever activities, whatever was like brought home was shared with the other child. So to be able to revisit with my older son now and go like, okay, and then as a parent who's trying to, parent differently than I was parented, right? Like these tools were not around, and not that my parents did this, but like, I'll just say in general, like yelling louder is probably not going to help my kids regulate better or their behavior improve, right? But that is kind of like an automatic response that I think a lot of parents have. Like, it's like, I said it nicely, and now I need to say it louder. I need to say it firmer. And aside from that, there's not a lot of other tools available. So I love that we're practicing these tools, and that it is a process, and it's not going to, fix everything right away. And if we can do it as a team, like a community, and come together for groups like this, I'm very optimistic about the work that you guys are doing, and that I'm personally impacted by it. So thank you.
Well, thank you for sharing that. Yeah, it's always very rewarding work for us. And that's why we kind of also, continue with this work. We're both moms, we both have very busy lives, we both have different jobs too, aside from Mighty OTs, but we keep coming back to groups and continue to say, okay, now what next? What group can we do next? We know we want to work on this. So let's develop a group for this. Last year we developed a brand new play group because we just saw a bunch of kids come through our group that needed to develop play skills. So we're kind of always doing that, and we really just continue because it's this type of work that really does it for us. We know we're making a difference. We connect with people, and it's really what kind of just fills our cup as OTs, right, Venita?
Yeah, we just fills our cup. But yeah, a lot of our groups are also based on the feedback we get from parents. I know we first started with the regulation group, and then a group of families are like, okay, what's part 2? There has to be like another follow-up group. And we're like, okay, what would you like to see? And so they were talking about social thinking, because we talk about that a little bit in our regulation group. And so then from that, a social thinking group came, and then we talked about executive functioning. So yeah, we just keep based on parent feedback, and where we see gaps, we try to create those groups to help.
That's amazing. And it's such a refreshing, I think, structure in terms of really promoting groups and the power of groups. So I'm excited to see what comes next with Mighty OTs. And we've been chatting with Kassandra Rago and Venita Rajput from Mighty OTs out in Edmonton, Alberta. And I really want to thank them for being on Taking Good Care today and to enlighten us on, all the work that OTs do. So thank you very much.
Thanks so much for having us. This was a wonderful experience.
Yes,
amazing.
Yes.
Yeah. And if you want to learn more about Kassandra and Venita's work, feel free to visit mightyots.ca, as well as check them out on Instagram. They are active on Instagram, and it's at mightyots. That's Mighty OTS. So check them out. And again, thank you so much for being on the show. And if you guys all enjoyed the episode today, all of our listeners, feel free to follow, give us a thumbs up, leave us comments and questions. We'd love to respond to them. And until next time, take good care.
Take care.
Right, take care. Thank you, guys.